My name is Mike Rhea. I am the Director of Resource Services for the ADRC of Central Wisconsin. Let's see if my arrow buttons will work here this morning. There we go. So what is an ADRC? Just to start off the bat here, ADRCs are a place to find unbiased information related to aging or living with a disability. In the state of Wisconsin, there's an ADRC in every county within the state. So even the information that I'm presenting today, even though it's tailored more towards the ADRC of Central Wisconsin, this information and the services are provided transcend all counties throughout the state, and you can find these same services at your local ADRC. I'll touch base on a little bit in regards to how to find your local ADRC and where to connect with that if you're not from our region, so that you have the opportunity to connect with them with any questions that you may have in the future. So what do we do other than providing unbiased information? And we'll dig into some of our services that we provide specifically in all the different opportunities that we have. But we really are that bridge from one life transition to another, connecting you to your community and those community resources that will hopefully help you maintain independence, stay living as independently and as healthy as possible in an area or residence that of your choosing. So a lot of people that's maintaining their residence within their own home and helping potentially build services around whatever support needs that you may have to be able to do that. We work with individuals, we work with family members, we work with friends, other professionals to help guide you through those options of support and services. Following today's presentation, if you have questions during the presentation, if you could either save them towards the end, we will have some time for a question and answer period, or you can put them in the chat function and we can connect that way as well. If there's questions following the presentation and after the question and answer, we can always answer those questions as well. So who do we serve? We serve all adults, older adults, 60 years and older. We also serve adults with disabilities, 18 and older. One thing that you don't necessarily hear right away when you hear the word Aging and Disability Resource Services or Aging and Disability Resource Center is the word disability. A lot of times people hear the word aging and feel that that's our only focus. While we do serve our aging population, we also provide support and services for individuals 18 and older who have a disability. So youth with disabilities transitioning from the children's world into the adult world. We do a lot of work with transitioning youth in that process. And also providing supports to helping them understand what those services and support may look like in the adult world. So our ADRC is located in Central Wisconsin. So we are located in Langlade, Lincoln, Marathon, and Wood counties. We have 5 offices within that 4-county region in Antigo, Marshfield, Merrill, Wausau, and Wisconsin Rapids. But there are, as I mentioned before, there are ADRCs through every county in the state. And if you happen to be looking for which ADRC represents your county, you can always go to the website that's listed. It's actually findmyadrc.com. That is a typo there, so it's not .org. It is findmyadrc.com. And that will bring you to a page that has all the counties in the state listed. You can click on the county that you're residing in, and it will give you the contact information for the ADRC that you're closest to. So what do ADRCs provide? Well, aside from being that unbiased source of information, we are designed to be the one-stop shop for anything related to aging or disability. We do have a contract with the state of Wisconsin. I'll talk a little bit later about how our services are free of charge. We don't charge for our services, and we are that unbiased entity that will provide you with the information that you need to be able to help understand all your options that you have for support and services. So we have several levels of service within the ADRC, and all these different levels of service provide a unique and different function. So within our ADRC, we have staff that are called resource specialists. Their job is to really assess what situation you have going on, what things have been working, what things have not been working, what are you seeking and looking for, helping connect you to resources, help you understand what resources are available, what all those different resource names, what they are and what they do. So they're really that first contact to help you understand all the different things that may be available to you for support and services. We also have what are called benefit specialists. This level of staff is really skilled at understanding and knowing all the complexities that go along with Medicare, Medicaid, private insurance, supplemental insurance, understanding all the ins and outs of all those different functions. They spend a lot of time sitting down with individuals, helping them look at what their current insurance is or what their insurance needs are, and helping them understand all the different options that may pertain to them. They also offer individuals who are new into Medicare. They offer what we call a Medicare Basics class that reviews all the different functions of Medicare, what it covers, all the different levels for Medicare Part A, Part B, Part D, prescription coverage, and all those different functions. We also recently, within this last year and a half, have what is called a dementia care specialist. Prior to 2022, which is coming up, there are only certain ADRCs throughout the state who had a dementia care specialist on board. As of 2022, I'm happy to report that we will have a dementia care specialist in every ADRC throughout the state. And really what the dementia care specialist role is designed to do is to do a lot of different functions. One, if a person is newly diagnosed with dementia, helping them understand that diagnosis, what are some resources and supports that may be available to help them with that new diagnosis. They're also available to help family and caregivers understand the disease process, understand what resources and supports are available, and to work with them side by side to guide them through that process. We're very fortunate to have one dementia care specialist for our 4-county region, but coming up in 2022, we will actually be hiring another dementia care specialist to help support that fairly large need within our region. Caregiver support, we also have what is called a caregiver support coordinator. Many times people become caregivers not by choice, but by necessity, either due to a loved one having some type of an event or increasing care needs. They didn't necessarily choose to become a caregiver, but now they're in that role. Maybe they don't have the understanding of what those functions are, but also just helping them understand what supports there are available to them as a caregiver. Understanding that becoming a caregiver can be a stressful event, and knowing how to not only take care of that person that they're caring for, but to care for themselves as that caregiver to make sure that they're healthy, that they're staying available, that they have the opportunity to de-stress and understanding how to care for themselves. So we do have caregiver support coordinators within our organization that can help walk through those processes, help them understand what supports and services that are available to them, and just provide that ongoing support to them as a caregiver. We also have healthy living programs that are very prevention-based. They're evidence-based prevention programs that can address and help individuals learn how to address things such as living with diabetes, preventing falls, living with chronic conditions. So we do have 7-week-based classes that are available to individuals at either no cost or very low cost to be able to take part in those classes to help them with those different conditions. These are, again, all evidence-based classes, so they've been researched for their effectiveness in preventing and delaying those impacts of those different conditions, and have been really effective. We do have these throughout our 4-county region. We have partnered with different entities to help support these programs and have actually trained volunteer leaders to be able to lead some of these programs throughout the communities. One of our probably most popular programs that we have is our nutrition programs. Many people have often heard of the term Meals on Wheels. We do provide Meals on Wheels to individuals throughout our 4-county region in every nook and cranny of each of those counties. We are fairly rural counties, but we do serve the entire county, all those 4 counties, with individuals who have that need for nutrition support. So Meals on Wheels, there is some eligibility requirements, including you need to be 60 and older and primarily homebound to be eligible for those Meals on Wheels delivered meals. But we also do have congregate meal dining sites throughout our 4-county region where individuals that are 60 and older can come. There's no eligibility other than being 60 and older, can come to those dining sites and have a nutritious meal during those meal site times. As with every human service and every entity and all of us throughout life, COVID has had a definite impact on some of the services and how we perform those services throughout this last year and a half plus. One of the biggest impacts has been our congregate dining site within our region. We do have our dining sites open at this time, but we did have to close for a period of time due to the COVID, all the COVID issues that we had going on. So as I mentioned before, we do get funding through several different pots of dollars. We have a contract with the state of Wisconsin for ADRC services. We also, for some of those services such as Meals on Wheels and caregiver support, receive federal Older American Act dollars. So we are the Older American Act dollar programs that are funded by state and federal dollars. So that allows us to have the opportunity to, again, not be unbiased and not be slanted towards any particular provider because we're not attached to them from a financial perspective. But it also gives us the opportunity to serve every individual, regardless of their income level, in what their need is. So there's some kinds of misnomers that because we're a state funded or federally funded program that we only serve and work with individuals who have lower income, and that is just not the case. Our goal is to help people early and to develop plans early so that they can utilize their own personal resources and stretch them out as far as possible before having to go into or need publicly funded programs. We are the entry point for the publicly funded programs as well. Those programs are for those long-term care programs called Family Care or IRIS. We are the entry point into those. We do what is called the functional eligibility and determine individuals' functional eligibility for those programs. We also work, because they are Medicaid-based programs, we also work with individuals to help them understand what their requirements are for eligibility for those Medicaid programs and work closely with them during that process as well. Again, most of our programs are free of charge. The only services that we do have potential fee for is there is a suggested contribution if you are connected to our nutrition programs. So if you receive Meals on Wheels or tap into our congregate dining sites, there's a suggested contribution. However, if individuals don't have the ability to pay that or don't wish to pay that, we don't deny people service based on that. So they can tap into those services, still get the meal, regardless of their ability to pay. Some of our healthy living programs, I mentioned some of those evidence-based classes, living well with chronic conditions, living well with diabetes, stepping on, which is a falls-based prevention program. Some of those do have a minimal fee, but again, if an individual is unable to afford that fee or doesn't have the ability to pay that, we will still provide that service to that individual free of charge based on how we receive our funding. So just to kind of tie into some of those services and things we do and tying all of this together are some scenarios. So these are some of the common scenarios that pop up for individuals. So for people coming to the ADRC, my parents want to remain living in their home. They're going to need some extra help with bathing, cooking, and cleaning. What are resources available to them? What happens if they can't afford to bring help into the home? That's a pretty standard request that we receive a lot of times from children of aging parents. Maybe they visited their parents recently and they see things aren't going as well as they could, and now trying to reach out and find out what resources or supports are available to help them to stay, again, independent and healthy within their home. My son has special needs and will be graduating from high school soon. What programs and services are available? Again, working with those youth that are transitioning from the children's world of services into the adult world of services and helping them successfully transition. Again, I've been struggling to get to the grocery store and preparing meals. My niece, who provides support, can't stop in every day to check on me, but does her best. What can I do? Would Meals on Wheels help? Or are there opportunities for grocery delivery? Or can we connect you to a grocery store that's local that maybe can provide some support? Or is there another support option available that may be able to help meet that need? So there's a lot of different options to be able to go through in every different scenario and situation. Another frequent question: my dad can't afford his medication, so is he splitting pills or not filling prescriptions? What is Medicare Part D? What is senior care? What other options are there? That's something we really want to avoid, and we definitely hear that from time to time as people not being able to afford their medications, and they're making a choice between, their daily functions of maybe food or paying bills, or picking up their medications or taking them the way they're prescribed. So, talking about some of those functions of our benefit specialists that we talked about, that would be a role or something that they could help with. How do I begin to understand Medicare? My sister has a disability and her Medicaid denied a claim. Can she appeal? So again, our benefit specialist, helping with that Medicare understanding, but also some of those situations where maybe you thought Medicare should have covered something, or your insurance should have covered something, and now you're getting this, large bill, and the provider saying that it's your responsibility to pay. Our benefit specialist can help unwind that, can help navigate through that process, and help advocate for you on your behalf. I'm exhausted. Caring for my mom is so rewarding, but it can be challenging too. I'd like to continue to help with her care, but I'm going to need a little help. What help is out there? So again, a fairly fairly common question that we get, from caregivers. It's rewarding. It's something I want to do. I know my loved one needs me, but how do I care for myself? How do I make sure that I'm really present in caring for myself, so that I can care for that loved one? And what supports and resources are out there? Is there respite available? How can I tap into respite? How do I understand where to go to for that? So sometimes situations change really quickly and you don't know where to begin. I always talk about in every presentation I give is that if you have any question related to aging or disability, to start with the ADRC. We connect with all of our community partners. I know part of the reason for this presentation today is our, being connected with Security Health Plan. We want to partner and help you understand what your options are. What is the situation going on in your life, and what are options for that situation to be able to help you, again, live as independently and healthy as possible. Connecting with us early. Again, don't wait until, if you can avoid it, don't wait until there's a crisis, but connect with us early to develop a plan for the what ifs down the road. We're happy to talk through those situations, to put some different resource options out there for you to be able to consider and think about as time goes on. Connect with us in all of our different locations. But your best life starts with the right information. So again, understanding all the different options, all the different resources. It's a very complex world. We're here to help unwind that and to be the support that you need all the way through that process. I can't ever do a presentation without putting a plug in for volunteers. So we do rely on volunteers within our communities. We have many volunteers that if without them, we would not have our Meals on Wheels program, as they deliver meals throughout our region. Sometimes as little as once a month, they'll come in and deliver a meal, or 2 to 3 times a week. But we do rely on volunteers to deliver meals. So if that's something that you have an interest in, we're always willing to take on new volunteers. We also have volunteers that do other different functions for us throughout our region. So we're always willing to help that, or to take those on. So connect with us if you have that interest. We rely on volunteers to facilitate our healthy living programs as well. So training those individuals to become leaders and trainers. So if you have that skill and that interest, we're more than happy to have that conversation with you. So you're always willing to call us. Always available for you, any of those needs and supports and services. And so that's our contact information on the bottom. That's our toll-free telephone number that will help you get directed to the appropriate staff, or you can email us at that email address on the bottom of the page as well. So with that, I think we're right in the time frame for some question and answer period. It's about 10 to 12. I'm happy to answer any question that you may have. Are there any questions that have come in through chat? I haven't seen that yet.
Yes. Well, first off, I want to say thank you for that information was really great.
Awesome.
And I do think I want to remind our participants today that we are sending a follow-up email with links to all of the resources that Mike identified throughout the presentation. And we will also provide a recording of today's webinar. So you will have that in your inboxes in, I would say, the next week or so. So I did receive a question, and it's, do you know what facilities have staff trained for dealing with dementia, behavioral issues, and working with residents to engage their brain?
Yeah, that's also that's a really good question, first of all. And I will say that it does vary based on facility in what their areas are. I can't necessarily list specifically, off the top of my head, the different resources or facilities that are best at that. There are several that call themselves a memory care facility, or tailored towards that of providing memory care or engagement. I would recommend that you have the conversation directly with one of our resource specialists that can sit down and really go through those resources with you to help understand your situation and help you understand what the different options are, but also what questions to ask. So when you're going to a facility or looking for any type of facility, it's not necessarily always what specific thing do they do, but what questions to ask prior to choosing one, because I think that's the biggest thing: what to look for, what to ask, what to identify to make sure that you're picking a good facility. I hope that answers your question somewhat, but I would just encourage to connect with us on a one-to-one basis for that answer.
Yes. Another question that we received: I am disappointed about the closing of Meals on Wheels at the senior center in Thorpe. The ADRC used to frequent our town to help with senior issues. I don't care for home delivery because I like engaging with other seniors locally. Are there any other opportunities for me to engage with others?
That's also a great question. And Thorpe is in Clark County, so that's not within our region. But I do, I would encourage you, and I'm not sure what's going on with their dining site there. It may have been closed due to a lot of different factors. I know financially things, kind of hit during the COVID aspect, or there may be a lack of participation that they felt like they needed to readdress their resources to a different location. I would encourage you to reach out to the ADRC in Clark County and express those concerns. We need, as ADRCs, to hear from participants of services, or to hear from people that are potential participants in services, so that we can make sure that we hear your voice, understand what service needs you have, and where to place those services as well. So I'm sorry to hear that's been closed or recently closed, or when it closed. But I would again encourage you to reach out to the ADRC locally to kind of tie up into some of those other options for socialization and connection.
Okay, we had another question come through, and this one feels super relatable.
Good, yeah.
The wind is behind me today is just wicked. So
Yes.
somebody had submitted a question. Can you please name the 4 counties that are included in our area? Our internet was down and I missed that information. I think you listed it earlier in your presentation.
Absolutely. So the ADRC of Central Wisconsin serves Marathon, Lincoln, Wood, and Langley counties. But again, there are ADRCs through every county in the state, and you can find those, and it's in the handout that'll be sent to you, but you can find those on the internet by either Googling or typing into the address bar www.findmyadrc.com.
Great. And I don't have any other questions that I see right now in the chat feature. I do want to remind our audience that if you think of something following today's presentation, we can always do our best to answer that, or we might tap Mike for some additional information, although he's provided so much. So you will have that option as well. And I think with that, we can go ahead and close.
Excellent. Thanks again for letting me talk to you guys all today. I appreciate it.
Yes, thank you. Be well, everybody.
Take care. Bye-bye.